Hi, my name is Griselda Lopez. I'm a dental hygienist and Burst Ambassador. And today I'm going to be going over how to communicate with a Spanish-speaking patient when you don't speak the language. The main thing you want to keep in mind is a lot of Spanish-speaking patients have certain slang that they use, so you want to try to keep the communication as simple as possible. Visuals are really going to be the key, whether it's intraoral photos, x-rays, videos. I even like to use Google Images to pull up pictures of what I'm trying to show the patient. When all else fails, you always have a patient mirror where you can give them the mirror and you can show the patient in their mouth what's going on. Sir, is anything hurting or bothering you right now?
Sí, mi perro me dio un cabezazo en este diente de acá y ahora me duele bastante.
What? So as you guys saw, the patient clearly indicated that something was hurting him. Whatever he said before that, I didn't really understand, but I clearly noticed that he touched his face. So I know that something's bothering him on the upper right side. So what I'm going to do is I'm going to go ahead and take some intraoral photos and some x-rays so we can check that out, so that I can have a visual of what to show him, and then we can go from there. Now that we've taken pictures and x-rays intraorally, we're going to go ahead and go over everything with the patient. So here in this area, you can see this darkness here. Do you have any pain? ¿Tiene dolor?
Sí.
Usted tiene, you have una caries, a cavity.
Oh, okay.
We will need to do a filling. Tenemos que hacer rellenos.
Ok, está bien.
Este diente, aquí, está partido. This tooth is cracked.
Oh, okay.
Aquí va a necesitar extracción. You will need an extraction.
Okay.
So now that I've gone ahead and kind of went over what his issue was and I've showed him what the problem was, we're going to go ahead and talk about a few common issues that you might encounter in the practice with the patient. Okay, a big major one is probably periodontal disease. So what I like to use for those specific ones is I like to use this model here. I received this model back in hygiene school, and I really like this as a visual. Even though I like to show patients x-rays as well, sometimes a black and white image isn't as visual as a model or an intraoral photo. Okay, so if I was going to talk to my patient about periodontal disease, I would obviously do the probing chart and the normal thing that we would normally do, but I would also want to show them a visual. Okay, so let's say, for example, the patient has active periodontal disease. I'm going to go ahead and show them the model and, show them the bone loss here and how the gum tissue is red and raw and swollen, and he can visually see that and understand that. And if you really want to ask questions, you could be, ask him if they bleed, sangran encias, that I'm asking him if his gums bleed. Okay, obviously you guys know that's a major sign of gum disease and bone loss. So then we can see from here it's healthy to a little bit of gingivitis to perio to severe perio here. Puede ver, you can see la raíz, where the bacteria goes in and the gums bleed. So if I was talking to him and saying, you have active periodontal disease, I would say, Tiene enfermedad de las encias. That's the problem. So the solution would be a scaling and root planing, okay? And because I'm talking to the patient, I'm not going to use the actual dental terminology for that, because they are probably 9 out of 10 times not going to know what I'm talking about, okay? So what I'm going to do is I'm going to say, You know, you need a deep cleaning. Necesita una limpieza profunda.
Oh, okay.
And that's how I would go about it. Keep it really simple. Photos, models, x-rays. Now, if we're going to talk about a root canal, this is a good model because it actually shows the roots of those teeth, okay? So when I'm talking to a patient about a root canal, they obviously are in pain. ¿Tiene dolor?
Sí.
They're gonna more than likely be in active pain because they have an active infection. And the solution would be a root canal, okay? So again, the problem would be infeccion en el diente, infection on the tooth. And the solution would be a root canal, which I don't know how to say that in dental terminologies. I could look it up. But the way that I normally tell patients is they need tratamiento de conducta, and they usually understand what I'm saying. Necesita un tratamiento de conducta. Okay, so let's take a scenario. The patient presents with crowding. They're aware, obviously, that they have crowding. So what you can do is you can show them an intraoral photo of their teeth that shows the area of crowding, or another option would be to show them an intraoral photo off of Google Images that shows the crowding before and after, so they can understand what you're trying to say as far as why you want them to or recommend orthodontic treatment, which is a big thing with them. Is they don't want you to just tell them what they need. They want to know why, which is going to be hard to translate it when you can't communicate with them. So visuals work really well for that, and videos do as well. Señor Lopez, usted tiene, you have a lot of crowding on the teeth. So what I'm doing right now is I'm showing him the crowding, and then that's the problem. I'm going to go ahead and give him the solution, which is orthodontic treatment or Invisalign. Usted necesita frenillos. I'm telling him he needs braces. Another scenario would be crowns. A lot of patients need crowns due to decay and other issues. So now that I have the model of the crown, I'm going to go ahead and show it to the patient. So we recommend a crown. Le recomendamos una corona. Okay. We recommend a crown. That would be the solution. A scenario for the night guard, I always like to have the model with me, and I usually take the intraoral photos again to show the patient how they're grinding. Okay, you are grinding your teeth. That's in English. So then I would say to the patient, usted está rechinando o desgastando sus dientes. And what I'm telling him is he's grinding or clenching at night. Okay. What I'm going to do now is I'm going to go ahead and show him the night guard. We need to make a night guard. Necesitamos hacer una guarda nocturna. Guarda nocturna means night guard. Most patients know what that means. They usually understand what that means. I hope that this video helped you to be able to communicate with patients better. A few things to keep in mind is you don't want to raise your voice to patients and think that they're going to understand you better because you say it louder. They're not. Okay, yelling at somebody isn't going to make them feel comfortable, and you just shouldn't do it. Okay, keep it as simple as you can. Take as many pictures as you absolutely can, and if you don't have an intraoral camera, try to use Google Images. I like the iPad because I could just hand it to the patient. As you can see, my computer's in the back, which makes it hard for the patient to view it unless I have them turn around. So iPads work great. Google Image. Google Translate works well too, but it's not 100% when you use Google Translate. The words don't always translate well. Okay, so you got to be careful with that. Models are great visuals for patients, and they can actually see it, pick it up, touch it. A hand mirror works great, so you can point to the patient and they can show you, and you can show them what's going on in their mouth. Okay, A good translation for dental professionals is this book right here. I've had this book since dental hygiene school. It really goes into a lot of the dental terminology and it translates it very professionally. There's actually a lot of words in here that I don't use, so I probably wouldn't use them with your typical patient because it's going to be too complicated for them. But there's a lot of great information here that just talks about common phrases, you know, hot, cold, bite, occlusion, crowding. It's a really good book. You might be able to, you can probably find this on Amazon. A good idea would be to laminate a card that has common dental problems and solutions translated into English and Spanish. So if you forget the phrase in Spanish, you can always look at your card and point to it for the patient. That still gives you the ability to communicate what you're trying to say to them. We hope these suggestions help some of you communicate better with some of your Spanish-speaking patients.